So I changed a little bit the title of my talk. I will really shift towards technological advances and in terms of understanding where standardization is needed. And that's a really key topic these days in understanding how we can take fluorescence-guided surgery and make it a standard of care or at the least comparable in measurement between different hospitals, different devices and so forth. But first I'd like to get a few slides on the background of tissue optics and what are the problems, what are the fundamental problems with dealing with light and tissues. This is just a hand in front of a white light source. As you can see, the light that was white turns red, and we can see light diffusing into the medium. So what's happening? A few things. First of all, tissue absorbs light, which can be depicted by this little cuvette measurement here. So light intensity diminishes as it travels to the tissue. The second effect is scattering. Scattering is formally the diffusion of these photons within the tissue. So tissue is not a very transparent medium. It scatters a lot of light, and primarily it's more scattering than absorption, actually. And the third one that we all talk about today is fluorescence, where we have the conversion of one wavelength into another by means of injecting a contrast agent. What you have to keep in mind is that all of these happen simultaneously into the tissues when you inject your contrast agent into your patients. And that's what we're going to deal with, trying to create instrumentation that can answer your needs. So, basics of fluorescence imaging, I call that fluorescence imaging 101 usually. What do you need? A contrast agent. We talked about ICG with an absorption curve in blue, an emission curve in red, and you need an imaging device. That imaging device shines light on the surgical field where the fluorophore is located and images it and displays it, and we see some great talk about how we can vary the way we display that information to the surgeon. So this is an example. It's been done a long time ago in lab of Professor Frangioni in Boston, where we do inject, here it's quantum dots actually, where we inject this in a pink limb, and we can see the lymphatic tracing in real time. This is basically speed up about 4 to 5 times, and we can go and locate the sentinel lymph node. We know it's a very powerful application. So very beautiful images, shining star on a black background basically. And we all believe, and that's why we're here today, that FIGS is a very promising tool. We have many imaging systems. This is just one of them. I don't preach for any particular device company, so don't ask me. But there's a lot of applications between angiography, between ureters imaging, between sentinel lymph node mapping. And we'll see a lot of these during the other talk